As the Paediatric Breakthrough Partnership, we harness our combined expertise to support interventions to increase access to testing, treatment and retention in care services for children and adolescents living with HIV, with the ultimate goal of ending paediatric AIDS in Mozambique, Nigeria and Uganda. We really strongly believe in the power of partnership, and it is our aim to show that impact working together is greater than it would be if we were working apart.
What makes us unique is the way that ViV Healthcare Positive Action has brought us together in a very intentional way and united under a common purpose that builds on our respective strengths. We each have very different perspectives. EGPATH as a technical authority, AIDS Funds, which brings the community voice to the table, PATA as a network of frontline providers, and UNICEF as a trusted government partner that actually led the development of the service delivery framework, which gives us our shared approach and a structure that enables us to focus our efforts together.
The partnership is unique in that it is developing an evidence base to show that a collaborative approach between national stakeholders such as government, clinics, communities and others works for implementation, and it is also an opportunity at the national level to reprioritize pediatric and adolescent HIV within the service delivery framework.
It brings together key strategic partners, creating a really critical and valuable learning platform where the collective capabilities and experiences from each of the partners can be leveraged in service delivery that is guided by policy and best practice while still being pragmatic and innovative. We therefore hope that all of this together can amplify the voice of health providers and young people on the front line of service delivery.
We're partners with the same purpose, so a healthy future for children living with HIV and ending pediatric AIDS. With this partnership, it allows us as AIDS Funds to really co-invest with ViV Positive Action in local organizations to implement community-based interventions and strengthen clinic community collaboration. Investment in communities are crucial if we want to reach all children.
When I look at Uganda and building of partnership, there should be a clear understanding of the shared goal all these partners are going to contribute to. It is making it easy for different categories of implementing partners. You have people that have been working at the health facilities in partnership with people that are working at community level. It has made the linkage a lot easier, and of course it will definitely give us better achievement.
For Mozambique, we as partners used the UNICEF's framework. We identified our gaps and different organizations bring different experience to the table, bring different knowledge, and we can attack the problems and implement very diverse activities in a more holistic way in order to achieve a better quality of care for children.
There must be willingness from all the partners to build a partnership. There must be transparency between all the partners. There must be part of a team player. Want to be part of the team and good interpersonal relationships. There must be a perceived value that each partner is bringing to the table. Leveraging resources, there's always a synergy that can multiply the results than you being on your own. It's important for us to be able to garner our strength, leverage our resources and minimize overlapping. So I feel that partnership is very critical and is the way to go in country.
Creating an enabling environment within communities that promotes a better understanding and appreciation that working together in partnership will help us reach our goals and improve treatment outcomes for children and adolescents. Secondly, investment and commitment to clinic community partnership is needed from all stakeholders. Thirdly, it's about nurturing and putting in effective systems and mechanisms to meet, plan and evaluate together. And lastly, but not least, is a strengthened relationship between health facilities, community structures, community-based organizations, and other implementing partners.
implementing the service delivery framework in a country, there's some very important ingredients for success and some of the lessons we've learned. One of the major lessons is the need of data. Data at the different levels of the health system. It also shows us critically where our gaps are in data. So it shows us what responses we need to put in place to improve the data in the country. The analysis of the data also helps us to know what part of the program is weak. So help us to know which strategies we need to apply. The other thing that the data helps us, it helps us to build the capacity of the program managers, and also helps as a coordinating tool for partners and stakeholders to see where they need to put their resources and collaborate for proper programming and improvement of coverage in the country.
Well, I think we're really excited about the years ahead. The previous year, 2020 to 21, was something of a pathfinding year, and of course, COVID took so much of everyone's time and energy during this period. But I think it was also a year that really helped our partnership to gel. We were all dealing with this together, and through that process, we worked together to build relationships with governments and other stakeholders. So now, because of this silver lining to the COVID pandemic, we had time to do the consensus building. And now I think there's nothing stopping us from building on this work to actually achieve some of the outcomes that we hope to do together.
The biggest opportunities in year 2 are for our collaborative database, global advocacy agenda, and cross-learning. The collaborative partners are jointly developing a database that all implementing partners can contribute to and access to monitor progress of the partnership, and it may also serve as a framework for expanding the partnership to other countries. The partners are also working on global advocacy initiatives to spotlight pediatric HIV progress and gaps and keep government and donor focus on these areas.
We will also continue to focus on providing frontline reality check and being an ear to the ground, capturing and documenting best practices, local challenges, and more importantly, homegrown solutions that can inform local guidance. Together with other partners, we will utilize the information to inform the development of comprehensive delivery models and tools that can effect programmatic change on the front line of service delivery.
Partnership building is really a continuous process. The coming years will allow us to grow stronger as partners. And both the successes and challenges will make us learn from each other and improve the quality of our work. Year 2 will also provide opportunities to start sharing our learnings and best practices beyond the implementation districts and countries where we're implementing, all with the aim of reaching more children and their families with the care and support that is tailored to their needs.